So I'm going to be showing local flaps, how they are supposed to be measured and drawn, because it is a big problem for learning plastic surgeons, since I have also experienced that problem during my post-graduation. So we're going to start with the basic one, which is a transposition flap. Now essentially a transposition flap is one in which the skin moves from the local area where you have the maximum laxity, and it is going to transpose in that manner. So suppose you have a defect, a random defect. First of all, the rule number one that you're supposed to use in this case of a flap is that you need to triangulate the defect. Now what we mean by triangulating the defect is that we need to make a defect which is of a random shape or even an ellipse shape into a triangle. The triangle that we prefer is an isosceles triangle. So we prefer an isosceles triangle and not an equilateral triangle, because the amount of dog ear formation and the movement of the flap is an inconvenience when you select an equilateral triangle. So we select an isosceles triangle where the two sides of the triangle are equal and so are the two angles, and we plan our defect. Now for making an isosceles triangle, what you need to know is be clear about what is the base of the triangle and what is the base of our flap. So here A and B form the base of the triangle and C will form the apex of this triangle. Now in order to plan a flap, we need a little bit more of extra skin as compared to the original defect. So what we are going to do in this case is that our base is actually going to be opposite to the base of the triangle. So from point C, which is the apex of the triangle, we are going to create a dotted line which is actually going to form the base of our transposition flap. Now how much should we extend this? Usually we take it as an arbitrary of plus 15% so that we get enough movement. So if your base of the triangle is about 2 centimeters, so 2.3 centimeter is what would be the base of your transposition flap. Now this line has to be parallel to this line, that is A and B. So once you've gotten your plus 15% is where you stop and you get your point D. Now this point D is in fact one of the most important points because it is going to be your pivot point. Pivot point is very important where all local flaps are concerned, because these are random pattern flaps based on the subdermal plexus, and this is the point around which your flap is going to move. So the pivot point is also important because along this point is your line of greatest tension. So from this pivot point, when you go towards the base of the flap, when you see this line is your line of greatest tension or maximum tension. You should know all these points for your practical exam. Now what we do is, once we have gotten this point D, we have to arbitrarily extend another line from this point. Now how do we extend this line? This line has to be parallel to line BC, which is one side of the isosceles triangle. At the same time, what we need to do is also extend this line BC arbitrarily. Now once we are done with this extension, so we have our extension from BC and we have our extension from the pivot point D. What we need to do is then take from the point D, we suppose take our pencil or we take our marker. From point D to point A is where we are going to cut across an arc. So from here you have to cut across an arc which is going to meet these 2 points at some place. So over here, so from this point D from A, so you get an arc that you cut across these two arbitrarily extended line, and where these 2 points meet is where we get the final points of our transposition flap. So consider this to be E and consider this to be F. Once you have gotten these points is when you have actually gotten your transposition flap. So once you connect these lines, this is going to be your flap. So in a transposition flap, there is no intervening tissue between the defect and the flap. If there is an intervening tissue, it is called an interpolation flap. So this is our transposition flap, and this is the base of the flap from where you are getting your blood supply. Now this flap is going to move in this direction to cover the defect. So most of the times what might happen is that this area may have to be excised and discarded. When you move the flap in this manner, what you are going to get essentially ultimately is a flap at the site of your defect, that is your primary defect, and the donor side, because you can't close it primarily, you are going to be left with a raw area. Now this raw area is most of the time skin grafted. So by definition, a transposition flap is actually where in between the defect and the flap you have no intervening tissue and you have to use a skin graft, SSG most commonly, or a full thickness graft at the donor side. So this is your final transposition flap. If you are planning a flap from the opposite side, that is, you have laxity on the other side, so in this case we had it here. Suppose you have the laxity on this side, you would ultimately plan your defect. You would isosceles triangle make it, you would triangulate it. Again, you would get a point C, extend it. You would get your point D, extend this line, extend this line. This would be your pivot point, this would be your line of maximum tension. Again, you would start from here, cut across an arc, get your 2 points, get your ultimate transposition flap, move it in this direction, and ultimately hence what you would get would be something like this with a skin graft required at the donor side. So this is your transposition flap, depending on where you plan it from, where you have the maximum skin laxity, and you should not distort any of the important anatomical landmarks.